Hi, my name is Akhil Sood, reporting for Room Now, here in Washington, D.C. Suppose you have a new patient with newly diagnosed lupus. They have the positive ANA, the low complements, and the classic rash. You start them on prednisone and hydroxychloroquine. Should you add anything else? Abstract 0664 found that when patients with newly diagnosed lupus were started on Belimumab, a biologic, early in their disease course, they were much less likely to receive lower doses of prednisone over the long term. And this is a big deal since steroids carry a wide range of side effects. Similarly, Abstract 0667 found that after introducing biologics including Belimumab, Rituximab, or Anifrolumab, within the first 3 months of diagnosis, patients were able to achieve lower doses of prednisone and lower their risk of relapse. And this highlights that early intervention with biologics is key for better control of lupus. But here's the catch. Despite these advances, Abstract 2421 shows that over the last 5 decades, the use of steroids in lupus hasn't changed that much. Even with newer biologics, many patients still aren't receiving them early in their disease course. So what does this tell us? While early introduction of biologics is key, and this can help lower the use of steroids, not all patients are getting these therapies. And we need to explore these barriers, whether it's physician hesitancy, patient concerns, or larger issues at the healthcare system level, including accessibility and affordability. These are the conversations we need to have to ensure every patient with lupus is getting the best possible care. Because at the end of the day, reducing steroid use isn't about the numbers, it's about improving the quality of care for our patients. Thank you.